Hi, my name is Johanna Sikaffy and I'm a counselor at Windmill Wellness Ranch, a treatment center for mental health and addiction. Dual diagnosis is when someone suffers from an addiction and also a mental health disorder. The connection that I have seen between mental health and addiction is that when individuals are dealing with uncomfortable feelings such as depression or anxiety, they tend to self-medicate in order to alleviate those feelings. So for example, if somebody is having feelings of depression, if somebody has a little bit of social anxiety, they tend to abuse alcohol or smoke cannabis or use other substances just to make them feel better. And what happens is that the person gets used to abusing these substances when they want to change the way that they feel. Some individuals are coping with depression, anxiety, or even with some symptoms of schizophrenia, such as hallucinations. So what happens is that because they're not aware of what's going on, either they're not voicing it, they are afraid to discuss their symptoms, they begin to self-medicate. What actually happens to an individual when they are coping with those symptoms by using substances is that they're actually developing a mental health illness and they're not dealing with their mental health issues. So they're not dealing with the symptoms of depression appropriately. They're not coping well with anxiety. They're not getting the proper medications if they have schizophrenia, if they have bipolar. So they're actually neglecting their mental health piece and they're developing an addiction. So if an individual is abusing substances at the same time as taking medication prescribed by a doctor, they will actually increase their symptoms and will make their mental health illness and addiction worse. Some research shows that when an individual is abusing alcohol, let's say for example, to deal with the depression, that could in turn also increase or develop another mental health condition such as anxiety. Some individuals still have that stereotype against addiction or mental illness. So when they have a dual diagnosis, they're easier to accept one versus the other. I have also seen that some people are willing to accept their mental health diagnosis, but deny that they have an addiction issue. And the problem is that if they're not willing to accept both of the problems, that they have a mental health issue and they also have an addiction, then nothing is going to work. Chances of relapsing are higher, and they're not going to be honest and trust the treatment team to help them move forward. Being in denial of one of their diagnoses will not help them cope with life better, will not help them deal with the symptoms appropriately, and they will actually not improve their quality of life either. They will continue to have symptoms of mental health if they're still abusing substances. And if they're not abusing substances but not taking care of the mental health symptoms, that will most likely increase the chances of them relapsing because they will still have symptoms. A person can address these issues if they are aware of them is number one, just be honest with the treatment team, be honest with the doctor, with the counselor, and also begin to get educated. The individual can also begin to receive individual counseling, family counseling, attend support groups, and also be involved with other people that are also suffering from the same mental health issues or addiction issues. So Windmill works with mental health and addiction at the same time. We also provide EMDR, family system therapy, cognitive behavioral therapy, other support groups, individual counseling, and also family workshops to get the families involved. The length of stay for an individual in Windmill really depends on their progress. We try to focus on the individual's needs. It's personalized. It's actually really helpful for the individual and also the family to know that the client is not being rushed into things or feeling pressured. What we want to do is just instill hope with the client, work with them, assist them in any way possible, and also help them develop the tools that they need once they go back into the community. I would also encourage the family members to get educated on the addiction and also mental health issues to provide the right support. We don't want families to enable a client. We want them to help them and support them in the right way as far as developing boundaries and being aware of warning signs or any triggers, At Windmill, we really support the families. We offer family workshops. We also have family meetings with the client, and we really try to incorporate that as part of the treatment team.